Hello, my name is Steven Skaggs, and this is a physical assessment of a 26-year-old female. She is Caucasian. Before the assessment, I gathered my equipment, provided privacy, washed my hands, and produced appropriate lighting. She is alert, and I would assess her as, in general, good-looking health, no obvious signs of distress. Her orientation, I'd ask a few questions. Can you tell me your name?
Tiffany,
And your date of birth?
5/31/88,
Good. And why are you here visiting today?
migraines,
All right. And can you tell me today's date?
September 22nd, 2014,
Very good. So oriented times 4. What is your height?
5'6",
Good. And she seems to be weight appropriate for age and height. Body is symmetrical with no obvious deformities. As she entered, her gait was smooth, even, and balanced. She seems to have good range of motion of all extremities, and the mobility is appropriate for age. No involuntary movements. And her hygiene, she seems to be clean, well-groomed. Clothing is appropriate for season and situation. Skin color is consistent with ethnicity. Her skin appears to be smooth, firm, no edema present in lower extremities, upper extremities. Her capillary refill is less than 3 seconds. Nails are a normal profile, smooth, clean, not brittle. Very good. Just checking the other hand. All right. Her posture when standing was good. She's proportionate. Her posture in the chair is also good with positioning as well. Her affect and mood are appropriate for the situation. She has good eye contact, calm, cooperative, speech is clear, spontaneous. She has appropriate speech and is understandable. Do you have any difficulties with hearing?
no,
Good. What would you describe your appetite as?
normal,
Good. Any weight changes recently?
no,
Okay. Any allergies to food?
no,
Alcohol use?
no,
Drug use?
no,
And do you do any exercise, physical
Yes.
activity? What kind of activity do you do?
I go to the gym,
Okay. So her nutritional status seems to be pretty good. All right. Next, we're going to look at the head and face. So first, it appears to be normal cephalic. I'm going to palpate the scalp. Good. It seems to be smooth, symmetrical. Any tenderness?
no,
Good. Hair is clean, not brittle. Her face is symmetrical. Next, I'll look at the temporal artery. Okay. Here we go. Which is good, equal on both sides, and the pulse is able to be felt. Also, we'll look at the temporomandibular joint. So I'm just going to feel right here and have you open and close your mouth for me. Very good. All right. Movement is smooth. Did you have any tenderness with that?
no,
Great. Next, we're going to look at the maxillary and frontal sinuses. Okay, tell me if you feel any tenderness.
no,
Fantastic. No swelling was felt either. All right, next we're going to test the eyes. First, we will do a confrontation test, which tests the peripheral vision. I'll have you take one piece of paper here and cover one eye, and I'll cover my eye that corresponds. And then go ahead and look straight ahead at me, and I'm going to have you, when you're able to see my finger flickering, to tell me.
I can see it.
Good.
I can see it.
All right.
I can see it.
All right. We'll go ahead and test the other side now. All right.
I can see it. I can see it. I can see it.
Okay. All right. So both eyes were equal on that, and she had good peripheral vision. Next, we'll do the corneal light reflexes. So I'm going to take one light, look straight ahead at me, and we're looking to make sure the bright spots are present in the same area on each eye. There we go, and they correspond, and so that is the appropriate response. Next, we're going to test the cardinal positions. So I will just have you follow this with your eyes in the direction it goes, okay? Very good. All right, eyes moved equally and no deviation. Okay, our next test would be the cover test. This looks for eye muscle weakness. So I'm going to have you stare straight ahead, and I will cover one eye. And then after a few moments, I'll take it away and see if there's any movement of the eyes to refocus. And we'll do that on the other side. Very good. And that was a normal response as well. We would also do the Snellen eye chart, which has the different alphabetical letters at varying sizes. I'd have her stand 20 feet away and cover one eye. She'd be able to keep her corrective lenses or contacts on if she wore them. And then I would have her read down to the lowest line that she could, and then I would have her try one line lower than that to test for visual accuracy to see what her level would be. All right. We would also look at her sclera, which to do that I'm going to have you look straight up. And I'm just going to pull down and look at the conjunctiva and also the sclera. Her sclera are white, the conjunctiva are pink, and no swelling was present. The corneas, we will shine a light from the side and look at. And they look smooth and clear. Right. No opacity or anything seen. Her irids are flat, round, and equal in coloration. Pupils are round, regular, and equal in size. I don't have the ability to darken the room very much, but we'll also test for light and accommodation. And so what I'm going to do is just have you look straight forward, and I'm just going to check for pupil reactivity here. Good. And then I'll look at the other side. Very good. Do this again. One more time. All right, and they were both equal and reactive. For accommodation, I'm going to have you look at that figurine in the distance over there. Okay? Look straight ahead, and then I'm going to have you focus on my finger. And both eyes focus together, and we're equal and reactive as well. All right. Next, we're going to look at the ears. Both are of equal size and shape and appropriately shaped for the face as well. No swelling, thickness is present. Any tenderness that you feel? No. Color is consistent with face. And next we'll do the otoscope to check the actual ear canals and tympanic membrane. All right. Just looking at the external canal here. Let's see here. I'm going to have you kind of tilt your head to the side. Perfect. There's no redness, swelling, drainage noted. No lesions or foreign bodies. All right. Looking into the ear. Let's see here. The tympanic membrane is pearly white, intact, shiny, translucent in color. All right. We're going to look at the other side. We have the same findings for the external canal. The tympanic membrane is also translucent, shiny, and pearly gray. So regular findings for that. Okay, next we're going to do the whisper test, which I'm going to hold one ear closed here, and with the other ear, I'm going to have you repeat back to me what you hear, okay?
Okay. 1, 2, A.
Very good. We'll do that on the other side.
3, 4, B.
Perfect. All right. Next, we will look at the nose. All right. It is symmetrical, midline, proportionate to the face. No deformities noted, no lesions. Right. I'm going to have you to inhale while I close one nostril. Okay. Any difficulties with that?
No.
Very good. Now I'll go ahead and I'll have you tilt your head slightly back. We're going to look at the mucosa. Okay. Which looks pink. It was smooth and moist. There is no draining or swellage on that side. And we'll check the other side as well. And that is the same findings. Also, her septum seems to be midline, no perforation or bleeding, and turbinates were similar in color with no swelling or polyps noted. Next, we're going to look at the mouth and throat. First, we'll look at the buccal mucosa. So I'll have you open your mouth wide. Good. Good. It looks smooth, pink, and moist. All right. Next, I'm going to have you smile real big for me. Good. All right. Teeth look white, clean, evenly spaced, straight. It does not look like any are absent, or can you open real wide? No disease looking present. Do you feel like you have any loose teeth?
No.
Good. And also, none were abnormally positioned. All right. The gums were noted to be pink with no swelling, retraction, bleeding, or discoloration. I'm just going to pull down this right here. Very good. All right. Next, we'll look at the tongue. I'm going to have you stick your tongue out for me. Okay. It's pink and looks evenly colored. Now, I'm not going to actually grab her tongue for this demonstration, but I will have you to touch the tongue to your roof of your mouth. Open a little wider. Very good. The veins are visible, no lesions present, looks good in color, pink. All right. And then we're also going to have you take your tongue and stick it out to one side. Very good. And the other side? All right. Also no lesions noted there. Next, I'm going to look at the palate. So, very good. The hard palate is slightly a wider in coloration, but pink, and the soft palate as well is pink, movable, and smooth looking. All right, I'm going to have you say "ah" this time. Stick out your tongue a little. Very good. The uvula is midline. It's movable and doesn't look like any swelling or anything of that nature. Tonsils were noted to be pink, grade 1, and no exudate present. All right. Let's see here. Next, we'll look at the neck. You have, yeah, perfect. It's smooth, supple, no masses noted. No jugular distension is seen or carotid pulsation. Let's see here. Next, we're going to feel for the lymph nodes. All right. Lymph nodes seem to be normal, not palpable. Next, we'll see the trachea. Right. Which appears to be midline. And when palpated, is midline, and no masses noted. Next, we'll look at the thyroid. So we'll have you tilt your head forward and slightly to the right. There we go. Okay. With the left hand, I'm going to palpate, and with the right thumb, slightly dislocate the trachea. Can you make a swallowing for me? Very good. It did not seem palpable or swollen of any kind. Next, we'll check the carotid pulse, which is strong, even on both sides. Very good. All right, next we're going to check the range of motion for her neck. I'm going to have you place your chin to your chest. All right, and then back up. The head backwards. Very good. And then look to the right and to the left. Very good. And then put your ear to the shoulder and the other side. Very good. All right. I'm going to have you shrug against my hands here. Good. And then turn towards my hand. Good. And the other side. Very good. Portion of the assessment, we're going to look at the chest. First, to note the thoracic cage. Let's see here. The shoulders seem symmetrical. Muscles seem symmetrical. The scapula are also symmetrical. The spine seems to be midline. The thoracic cage is elliptical and downward. I'm going to check for symmetrical expansion. Can you breathe in real deep for me? Very good. All right. We're also going to go ahead and I'm going to palpate the back and look for any tenderness, any masses. Any tenderness at all? Okay, and no masses felt either. Right, relaxed posture. Next, we're going to go ahead and look for tactile firmitas. So I'm going to have you say 99.
99.
And again.
99.
Okay.
99. 99.
Good.
99. 99. 99.
And one last time.
99.
Good. We're also going to go ahead and percuss. So I'm just listening for resonance here. Good. All right. Next, we're going to listen to the lungs from the posterior side here. I'm just going to have you take some good breaths for me. Very good. And lung sounds seem to clear. All right, next we'll do the anterior approach. Okay. Here we go. I'm going to first feel again for any masses, any tenderness. Any tenderness present? Okay. Let's go ahead and do the 99 again.
99. 99. 99. 99. 99. 99.
Very good. All right. We're also going to go ahead and do percuss. All right. I'm going to listen to the lung sounds from the anterior approach. Just good breaths in for me. And I'll just kind of have you lift up for me here. Okay. Good breath. All right, and then down. Okay. All right, and lungs field sounded clear. All right, well. Next we're going to test whispered ventriloquy. And I'm going to have you say 99, but in a whispered voice, each time you feel my stethoscope on your back. Very good. And we're going to do the same to the front. All right, and that was a normal finding. I wasn't able to hear anything through her lungs. Alright, next we're going to say 99 again, but we're going to do it at normal voice. And that will be bronchophony that we're testing for.
99, 99, 99, 99, 99, 99, 99, 99,
And then in the front.
99, 99, 99, 99, 99, 99, 99, 99.
Very good. And that was also a normal finding. The very last one we're going to do is egophony, and that is going to be the letter E, and just say E long. Okay? And we'll do that each time as well.
E, 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 E,
And then on the front.
E, 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 E.
Very good. Alright, and that was still the letter E sound, so it was also a normal finding. The next assessment we're going to do is going to be the heart. Alright, first we're going to auscultate all 4 valves with the diaphragm and then the bell. Alright, next we'll use the bell. Okay, next we'll do the apical rate and rhythm. We'll listen for a full minute. Right. Apical rate was 66, and it sounded like a regular rhythm. Okay.